your family doctor will probably be the first person involved in the diagnosis and treatment of your back pain. Depending on the severity of your pain, diagnostic tests to be done, and the treatment you require, other physicians and healthcare providers may become involved. Your doctor may refer you to a pain management specialist who can coordinate your care between a variety of specialists as needed. A neurologist might assess you to establish the exact diagnosis by EMG studies, and a radiologist will be responsible for many of your diagnostic tests. If surgery is an option, a spine surgeon will be consulted. A rheumatologist may also become involved in your care if osteoarthritis or rheumatoid arthritis is involved in your pain. A pain specialist may also assist you in your pain relief by performing specific procedures or nerve blocks. Management of your back pain will almost certainly involve physical therapy that will be supervised by a physical medicine specialist and/or a physical therapist. To assess your lower back pain, your doctor will take a thorough medical history and do a physical exam. The history will include episodes of trauma that may be causing the pain, such as twisting, falling, or an impact injury such as a car crash. The history can also help to identify another condition that may be associated with the pain. The doctor will also want to know the characteristics of the pain, where it hurts, how you describe the pain, when the pain began, the current severity, what relieves the pain, what makes the pain worse, and any limitations in movement, as well as previous episodes and health conditions related to the pain. Also, how the pain affects sleep and is it related to stress, etc. Make sure that you tell your doctor about any other medical problems you might have, as well as any current medications you're taking on a regular basis. The physical exam will include an assessment of your ability to bend and twist and to raise your legs straight while lying down face up. Your doctor will also look for evidence of any bruising or deformity. Your doctor will examine your back and carry out specific neurologic tests to determine the cause of pain and appropriate treatment. Tests may include assessment of whether or not you have normal strength, whether your sense of touch or muscle strength has changed, and whether your reflexes are normal. There are a large number of additional diagnostic tests that your doctor may use to help determine the cause of your pain. The first test is often a conventional X-ray, which can reveal broken bones or a compressed vertebra. This fast, non-invasive, and painless procedure is usually performed in your doctor's office or at a clinic. Your doctor may also ask you to undergo other tests aimed at providing more information about the anatomy of your back. Computerized tomography, also called a CT scan, is carried out with a combination of X-rays and a computerized scanner. This procedure is also painless and is often used when disc rupture, spinal stenosis, or damage to vertebrae is suspected as a cause of low back pain. Computerized tomography is generally conducted at an imaging center or hospital. Magnetic resonance imaging, also called MRI, is another way for your doctor to see the anatomy of your back. This procedure can provide a very precise picture of the bones, muscles, discs, and ligaments. Like CT scanning, MRIs are usually carried out at an imaging center or hospital. CT scans show bony abnormalities better, while MRI shows the soft tissues and nerves better. Your doctor might also recommend that you undergo discography. A special contrast dye is injected into the intervertebral disc thought to be causing low back pain. The dye outlines the damaged areas on X-rays taken following the injection. This procedure is often suggested for patients when the intervertebral disc is suspected to be the source of pain or when the surgeon is sure about the level he needs to operate on. Another diagnostic procedure that involves dye injection is called a myelogram. The contrast dye is injected into the spinal fluid to outline the spinal cord and nerves. It helps to assess nerve compression caused by spinal cord and nerve compression caused by herniated discs or fractures to be seen on an X-ray. Bone scans are used to diagnose and monitor infection, fracture, malignancy, or disorders in the bone. A small amount of radioactive material is injected into the bloodstream and collects in the bones, particularly in areas with some abnormality. X-ray images reveal the radioactivity and are sent to a computer to identify specific areas of irregular bone metabolism or abnormal blood flow, as well as to measure levels of joint disease. Your doctor might also recommend any of several electrodiagnostic procedures. These include electromyography or EMG, nerve conduction studies, and evoked potential studies. Electromyography assesses the electrical activity in a nerve and can detect whether muscle weakness results from injury or a problem with the nerves that control the muscles. Very fine needles are inserted in muscles to measure electrical activity transmitted from the brain or spinal cord to a particular area of the body. In nerve conduction studies, the doctor uses 2 sets of electrodes that are placed on the skin over the muscles. The first set gives the patient a mild shock to stimulate the nerve that runs to a particular muscle. The second set is used to make a recording of the nerve's electrical signals. Your doctor will measure the speed and strength of the signals to determine whether there is nerve damage. Evoked potential tests also involve 2 sets of electrodes, one set to stimulate a sensory nerve and the other set on the scalp to record the speed of nerve signal transmissions to the brain. Your doctor may also use injection of a local anesthetic to selectively numb certain nerves or joints and assess any change in symptoms. This can also help to localize the source of your back pain.